All right. Hello, everybody. Good morning, good afternoon, good evening to wherever you are. I'm Wolf Kirsten, the co-director for Global Center for Healthy Workplaces, and I'd like to welcome you also in the name of Tommy Hutchinson, the other co-director of the Global Center, for our webinar today, Return to Work, Global Workplace Strategies and Guidance. We have a great group together again, a very diverse group from many different countries and different organizations. So thank you for joining, and I'll introduce our speakers in a little while. First off, I would like to make a couple of announcements. First, in terms of kind of housekeeping, if you have a question, any comments, use the chat box. The last few webinars, this worked really well. We've had great feedback, or also resources to be shared, and everybody can benefit from that. And of course, we want your questions as well. So please do that at any time during the webinar. The Global Healthy Workplace Awards program is right now in process and going on. And we have a deadline at the end of June. I just want to remind you, it's open to all organizations, public, private, large, small, any industry. Just follow the criteria on the website. So please do take the chance to take a look at that, as we've been running the awards for 8 years now. So thank you. I also would like to make you aware of, we have a webinar next week specifically for the Asia Pacific region in terms of the time zone. So for some of us, it will be in the middle of the night. But of course, we want to accommodate our dear colleagues in Asia and the Pacific region as well, as they have been wanting for a while. So we look forward to that very much next week. So please share with your colleagues if you will. And then, of course, I would like to welcome our Global Alliance for Healthy Workplaces members to be on the call. And we've had some great discussions over the last couple of months in this difficult time. So please keep it going. Also virtual, not just on the webinar or through the phone. So please keep your comments coming. So that would be great. So our topic today is return to work, or maybe more accurate would be return to the workplace, as I think we've all been working all along. But a number of countries are now opening up, and hopefully your country is opening up too. And of course, that's the challenge for all of us. How do we open up, at what speed? So it's a gradual process, I think we all agree. And some countries are still a little further behind. So at that time, now, of course, employers are looking at how to get employers back to the workplace safely. That's a priority. Depending on the type of company, the industry, of course, some have never left the workplace because they had to be there. If we think of our essential workers, and especially at the healthcare workers that have been working so hard. But I would say a large number of, maybe the majority of employers are really trying to get employees back to the workplace. But at the same time, the big question is, well, how many of those are actually going to stay working at home, having done that for the last at least two months? Very interesting dynamics, especially in the HR, human resource space. So we would like to take a look at this today, around what are the immediate challenges. What will the new working world look like? I think we all don't know for sure, but I think we all have an idea. And what do we need to keep in mind to enhance employee safety and well-being? And are there any good practices around this yet, maybe, around returning to the workplace? And I invite all of you to share, but we'd like to kick it off with two excellent speakers from two international organizations. We're really glad to both have them on. Our first speaker will be Luis Rodrigo Morales, who is the senior advisor at the IOE, which is the International Organization of Employers, and he will share more about what the organization does. But it's a large umbrella organization of all national employer organizations. And then also we have Dietmar Elsler from the EU, from the European Agency for Safety and Health at Work, EU OSHA, or the Bilbao Agency, as it's also known in Europe. And Dietmar is with the Prevention and Research Unit. So we're very happy, very glad to have both of you on. And both organizations have developed guidance documents, guidance reports, which will be both of you will be sharing. So we very much look forward to hearing more about those two. So I think I'm going to start sharing my screen, and I'd like to ask Luis to unmute yourself and start introducing yourself, please.
Thank you very much, Wolf. And first of all, thank you very much for the invitation to talk to you in a very timely moment. We really appreciate the Global Center for Healthy Workplaces for this opportunity. As you rightly mentioned, I am Luis Rodrigo Morales from the International Organization of Employers, the largest global network of the private sector. We were established in 1920, so that means that we are celebrating our centenary this year, a very disrupted centenary, but yet 100 years of work engaging in the social and employment policy debate taking place in the ILO and in various organizations such as the UN and the G20 and the GFMD and all the emerging forums. We represent more than 150 business and employer organizations, which represent also 50 million companies. So that's how large we are in the policy debate. Of course, as an employer organization, we stand at the forefront of the advocacy for business sustainability and resilience in times of COVID. So we've been working a lot these days, as you can imagine. So to give you a bit of context on the times we are living, this COVID-19 emergency has turned from a health crisis into a severe economic disruption with serious consequences for the labor markets, economies and enterprises, including global supply chains, this leading to widespread business disruptions and a severe impact in employment, as you can imagine. It is clear that the pandemic does not only impact lives, but also livelihoods. The reduction in demand and the disruption in production of goods and services has pushed the world economy into an unprecedented downturn. Here you can see some numbers, some interesting numbers to see the size of the disruption. According to the ILO, around 436 million enterprises in the hardest hit sectors worldwide are currently facing high risks of serious disruption. And more than half of these are in wholesale and retail trade. And small enterprises account for more than 70% of global employment in retail trade and nearly 60% in the accommodation and food services sector. Also, from the OECD side, they estimate that the lockdown directly affects sectors amounting to up to 1/3 of the GDP in major economies, and for each month of containment, there will be an estimated loss of 2 percentage points in annual GDP growth. So it is in this context that we see the need to accelerate the reactivation of our economies, and for that, back to work is crucial. And at the same time, we have to look for the health of our workers, as pointed out by Wolf. So we will move to the next slide. We can see that there are various strategies. They vary widely, and there are simply no one-size-fits-all solutions. The virus indeed is the same worldwide, but the impact in each country is different, and the responses and the economic capacities vary greatly among countries. Here is just a representation of two opposites. I chose Switzerland, the country where I'm speaking from, where we are based, where our organization is based, where we started on 27th April with a first phase of the confinement by the reopening of some businesses, then moving to a second phase on 11 May, where we are now. And then we're going to move on the 8th of June to a third phase that will represent a wide opening of more businesses. To the date, we are suffering only 15 cases per day, the very last days, and only two diseases, unfortunate diseases. But we are talking about a developed country with less than 9 million inhabitants. On the contrary, Mexico, the country where I am from, it's faced yesterday the highest number of contagious, raising by 3,455 new cases, and unfortunately 501 deaths in just one day. Yet they have already started the confinement in specific industries such as automotive, mining, construction, and they are basing the confinement on a self-evaluation of the health and safety protocols of these industries. So one thing we can look from the various countries and strategies is that we are aiming at, in general and ideally, at mitigating risks for all staff and prevent further possible spread of COVID-19. And at the same time, which is very important from an employer's perspective, is to offer a strategy to restore the economy in a most responsible manner. In all this process, employers of all sizes and of all sectors are seeking and looking for guidance and expert advice on how to implement safe and effective back to work policies. And this is why we, as an international organization of employers, have launched a guidance, a checklist guide, as we call it, for managing return to work. So if you see now on the screen, this is the way we structure our guidance. The guide does not aim at providing absolute responses. As I said, there's no one size fits all. But there are some considerations that we should take into account. So we are trying to tackle them in this checklist. So first of all, I have to stress that information is key, and for that we consider that the sharing of good practices, experiences, and how other countries are tackling the pandemic and the confinement and all the return to work strategies is key. And that's why the role of employer organizations is very important. That's what we are stressing in the first part of the guidance, and then we touch upon other sections concerning the decision to return to work, the implementation and execution of the return to work strategy, and coping with after effects, and how to sustain the right culture post-COVID. Also, how to embrace the new realities of work. If we can turn to the next slide, please. We as employer organizations offer guidance on how to make workplaces safe. This mostly happens at the national level. That's why it is very important for businesses to engage and to communicate closely with their employer organizations. They can help assessing the business impact, as well as run an evaluation of business contingency plans, and of course they advocate for employers at national level and work closely with governments on measures and policies that better fit each scenario and each economy of each country. So that's why it is very important to keep in touch with your employer organization. If you move to the next slide, we have then the very first important step on deciding when to return to work and what are the considerations that we should take into account for taking this very difficult decision. So again, data is very, very important. We have to see what is out there, what is the size of the risk, and know better ourselves, our companies, our sectors. So one of the simple questions we have to think about is the size of our team and how can we handle the whole team or part of it back to the work premises. We have to acknowledge that the virus is there, it's out there, and we are going back to work in an ambience where we have to keep on being careful. So we have to think about who qualifies as essential, who has to be at the workplace to keep the business ongoing, and we have to think about various considerations on who should return, and perhaps based on considerations such as area orders, worker profiles, and personal aspects such as the vulnerability of some of our workers or their exposure when they commute. If business is fit for teleworking is very important. Most of us, or in many sectors, we have been teleworking, and we have found a solution on that. And of course, be mindful of the regulatory restrictions that we may have while taking this decision. Also, an important consideration is if we can implement a phased or a staggered approach, and the precautions that we have to take to ensure a safe workplace, among others. If we move to the next slide, we talk about coping with after effects. Once we have taken the decision to go back to work, and I prefer to say back to the workplace, because as was mentioned, many of us have been working non-stop, and some of you might be facing even larger hours of work in this time. So when we return to the workplaces, employees who are returning and those that are hired will want to know that they are working in a place that is free from hazards. So they want to feel safe. So how can we deal with that? Because we have to acknowledge that there is no back to a normal scenario. So how to deal with the potential fears, and how are we going to secure a workplace that is precisely free from hazards, and if we are ready for potential spikes in infection. We have to bear in mind and have a strategy and anticipate possible scenarios. If we move to the next slide, sustaining the right culture post-COVID, it is again very important to look after our workers, because as we quote here Richard Branson, clients do not come first, employees come first. And if you take care of your employees, then they will take care of your clients. So aside from getting back to the facilities and getting facilities operational and employees back to work, how the workplace culture will or should change in order to secure the safety of your workers is very important. We have to keep in mind that we have values and we have guiding principles that have to be observed and reviewed accordingly. We have to look at the rules for implementation of a strategy, and also be mindful and see how we can support our staff and the families of our staff. It's very important. On embracing the new realities of work, here for the Matrix fans, what if I told you? And what are the lessons learned from the crisis? So indeed, what if I told you if we could telework and still get things done? That was one of the responses many of us have found, but some others that have not been able to telework have found also other types of responses for resilience and to keep the business ongoing. So it's very important to see which of those lessons of new practices should remain, should constitute the new normal, because the pandemic has forced most of business to find and explore solutions for business continuity. So how do we leverage existing workplace flexibility technologies, for example, for teleworking or for virtual teamwork and so on? Then what have we learned and how we can transfer such knowledge for the future? How can we also join forces among companies? Most of small companies who happen to be competitors might find also good solutions by joining forces. So talking again to the employers' organizations among sectors remains very important. With that, I turn it back to you, Wolf, and we remain at your disposition for comments and reactions. Thank you.
Got to unmute myself. Thank you very much, Luis. Much appreciated the presentation. So I think obviously there may be some questions. I haven't checked the chat yet, but let's move on to our next speaker as introduced earlier, Dietmar Elsler from the EU OSHA agency in Bilbao. Dietmar, you please proceed. Please go ahead. Did you unmute yourself? Dietmar, are you there? We cannot hear you right now, at least I can't.
Wolf, while we're waiting for Dietmar, can I ask a question to Louis? The WHO say there should be a 1 meter rule, physical distance. Some other countries, like the UK, say it should be 2 meters. What, and which clearly has a big effect on businesses. Is there like a global consensus around this issue? Are people applying the WHO rule, or are they doing their own thing? Is there like a consensus?
Should I jump in now, Wolf? Or...
Yes, please go ahead. Yeah, I think that was for you, the question. Yes.
Yes, of course. Thank you for the question. Indeed, social distancing has been one of the main and most diffused recommendations coming from the WHO and among all the organizations. So that's precisely why some sectors haven't been able to go back to normal or back to work earlier. The 2 meters distance is a principle that most governments recommend. Yet, as I mentioned, some countries are already lowering this type of restrictions. The good example is Switzerland, that today announced the possibility of gatherings of more than 5 people as it used to be, and turn it to 30 people and so on. So approaches vary, but indeed social distancing and washing the hands is the most widespread recommendation.
Okay, I think Dietmar, I see a microphone on green, so please proceed. Please go ahead.
Okay, can you hear me now?
Yeah, perfect.
Wolf?
Yeah, very
Oh, perfect. Yeah, great. I'm relieved. So I discovered there was a problem. I could also unmute my my headphone set here, which I didn't know before. So I discover something technical new every day.
Yeah.
So thank you, Wolf, very much for this kind invitation to the meeting. Indeed, our agency is based in Bilbao in Spain. And maybe you heard in the news that just today, Spain started a national mourning of 10 days because, Spain was very heavily affected by the COVID-19 pandemic, and there are more than 27,000 victims of the pandemic. So we are really hardly hit in Spain, and there was a very strict confinement. but as everywhere in Europe, so I was seconded to this European agency by the German government originally. So I know in Germany the situation is more opening now. They are discussing much more opening the constrictions, but also in Spain now slowly the economy is slowly going on. Bars are opening outside, restaurants are opening outside, so you can even go to the beach if you keep the distance. So life is slowly coming back to normal. And maybe next slide, Wolf. So maybe we are in our agency, we are also going back to normal. We since mid of March we have been in confinement, and basically we have all been sent to telework. And now we will go next week. We will go to back to work in a step-by-step approach. Maybe I say more about that later. So our agency was established 25 years ago. So we had the 25th anniversary last year, and last year we could still celebrate it with everything that we wanted. So that was great. And our ambition, our aim is to improve the working conditions in Europe, and mainly through providing information, technical, economic, and scientific information about health and safety at work, mainly through campaigns with different topics, and also through research projects. For example, I'm doing mostly research on economic benefits of health and safety, which is very interesting to provide the business case at business level or at national level for occupational health and safety. And what is special about our agency, so we are an official EU agency, and our board consists of all the European 28 member states, and from all stakeholders. We have 3 representatives of governments, employers, and workers' organizations from each country, and from the European Commission. And next slide, please. So we are mainly focusing on, as I said, on raising awareness in health and safety campaigns, but we are also providing tools for risk assessment. For example, we have the online risk assessment tool, OIRA, and where we just developed a new COVID-19 tool or module, which then you can implement, which we also translated already in several languages. Maybe next slide, please. And we are also now with the COVID-19 pandemic. I made here a few screenshots. Maybe this is difficult to read for you. So we have also our famous NAPO character, where we have for different topics and campaigns, we have made some little clips, video clips. And for example, we have one brand new, Stop the Pandemic, and another one, which is very timely now, is about telework, how to design telework. So these are topics also, telework and musculoskeletal disorders, which is basically our next campaign, which was due to start in October this year. But some of the material we have seen, we can use it already now, so which was already ready now to be published. And the advantage is that we can publish it in 27 languages. And that is also true for the guidance that we developed now for the COVID-19 and for the return to work protocols. This is also that it was consulted in this with the European Commission and also with the tripartite board. So we had about 200 comments from the member states and from the different organizations to deal with. But I think then in the end, we developed a very good and accepted guidance, which also shows the first feedback. And of course, in this short talk, I can only introduce this guidance, which maybe shows the general principles. And as most of you are OSHA professionals, you will be aware of these general principles anyway. But it's just to say that we have an agreed tripartite agreed paper on European level by all member states, by all the employers, workers, organizations. So I think that is also a politically agreed paper from the EU. And then we have provided for this guidance, in addition, there's an OSHA wiki article. So we have a kind of Wikipedia for health and safety. And there you can find a lot of more country-specific and sector-specific information, because one of our big tasks is good practice sharing. When we look also, of course, what is happening in each member states. For example, is there specific construction guidance in German language in Austria and Germany, then we will share it. Or is there something about hairdressers in Spain or in France? So we share this specific guidance as well. And now I would like to introduce a short to our guidance. Next slide, please. And yeah, this guidance, as I said, was developed in a tripartite process. Maybe next, yeah, thank you. So next slide, please. Yeah, and of course, most important thing when starting is exactly to minimize the exposure to COVID-19 or to the SARS coronavirus 2, and to put in place the hierarchy of control we all know about, and now first to avoid the risk and then avoid the exposure to the risk. So maybe if at this time you can generally think if you have to carry out this work now in these times of the pandemic, or if it can be postponed to later on. So if it's work which is involving contact with other people among the workers or with clients, and you can also minimize, reduce as far as possible the physical contact with workers or with clients. You can, for example, if you have offices, you can try to avoid that there are several people in offices, or if that is not avoidable, then you can put barriers between the people. So we are also thinking about that when we are returning to work next week. So we will return in stages, as I said, first 10% and maybe 30%, 50%, and also in order not to populate the rooms too much in the first days, and of course provide protective equipment. In Spain, we have now also the obligation for masks in public places and also in shops. So the mask duty came quite late here, as masks were not available. And then the usual things, provide soap and water or hand sanitizer, and yeah, put in place flexible policies for working remotely. So of course, this minimizes the risk whenever possible to work remotely. Next slide, please. Because a big topic nowadays is then also managing the workers from home. I think especially for management, you don't have the day-to-day contact to work, and then managing your workers from home is a special challenge. And also there, it's the first step is to carry out a risk assessment of the workplace, and to allow workers to take their equipment with them, what we have also seen in our workplaces, because for many workers it was the first time that they were teleworking actually. So in our agency it was quite, let's say, common, but for part of the workers, but many others, for them was the first time, and I think in the whole economy was the first time for them. So it is an unusual situation. You might work in the kitchen or somewhere where it's not so well equipped, and then it can be easy if you can pick up just stuff from your workplace, like a monitor, like a keyboard. I did it myself. I got a larger screen from work and a better keyboard. So that's very helpful when you have to work for weeks or months at home and not even for a few days, which you may did not consider before. And yeah, we have a lot of guidance how to design your workplace ergonomically, what we also take already from our MSD campaign, which is upcoming. And yeah, if it's possible, give IT support, because not everyone is used to work with all these teleworking tools, with conferencing tools. And what is very important is ensure communication with management and workers, but also among the workers. We have seen it's very helpful that you have to ensure also this informal conversations, that you have a kind of virtual coffee breaks, for example. That is also encouraged by our management, that we have, I don't know, every day 15 minutes where we can chat with our unit and have some informal chats, not to lose the contact to the colleagues. And this is also, I think, for the psychological well-being very important. Next slide, please. So when you resume the work after a period of closure, what is now the case for us on many other places? So we have to reconsider the whole workplace, also reconsider the risk assessment in the workplace, where to avoid any possible contact or to reduce the contact between the workers. For example, if you have a kitchen for breakfast or something, common rooms or toilets, that you really put simple procedures in place, that if the restrooms are occupied, so nobody else should enter there, or in the kitchen nobody should enter when someone is preparing his or her meal in the kitchen. So very simple procedures, just putting one in one office, just introducing a shift system, or yeah, if you have open plan offices, put barriers between the workers, just to do everything, yeah, to minimize the risk between the workers. Then maybe some workers went through the COVID-19 disease. Maybe some workers have even long-term effects. There could be something like post-traumatic effects. Some workers could suffer from anxiety because they are anxiety from infection, for example, or general work stress, general adaptations to the workplace. So, and we think that it's very important to have then the support of the management, that could range from just more often asking the employees, how are you doing, and how we can support you. And if you are more advanced, I mean, your organization, you can also provide counseling service, or you can put in place buddy systems between the workers. So there are a lot of possibilities. And yeah, we think it's really important to adapt the workplaces. So when you're coming back, and we are recommending a stage approach. So first start with maybe 10%, 30%, 50%, until you have the full range of workers. Next slide, please. So yeah, as I said, we have a lot of information on this, also regarding specific sectors in Europe. And we see also a link to our upcoming campaign. As I said, for example, teleworking can be a cause of musculoskeletal disorders, for example.
Dietmar,
yeah.
Sorry to interject, but we have some other presenters, and we are
okay. So sorry. So I
think we need to speak on. Thank you.
Yeah. Okay. Just the last slide. I wanted to mention that within this campaign, we have the possibility to collaborate with us as campaign partners. I'm also coordinating this program of campaign partners. So we are organizing a range of interesting events. So normally in May, we would have arranged a meeting with Peugeot in Paris, where we would have had a good practice exchange meeting already on the musculoskeletal disorders campaign. And you see here the logos of some of these campaign partners who are very happy to share their good practices with us. And also we can provide a lot of information to them. As I said, we have a lot of information material in all the European languages that global enterprises can use this in their global plans. And I think that is an added value for us as OSHA, as spreading better the message of our campaign and getting closer to the workplace, but also for the companies that they can get the good practice exchange. And also we offer a certain visibility, and it's, of course, it's for free, the engagement with us. We just would like have a certain commitment that you support our campaign. But as I think we all agree that we support health and safety, that should not be a problem. Okay, thank you very much for this opportunity.
Thank you so much, Dietmar. Really appreciate it. And also thank you to Luis. Before handing it over to Tommy for the ongoing discussion, I'd like to ask our dear colleague from India, Dr. Raj Gopal from Unilever. He's the corporate medical director of Unilever, just a small company you may have heard of. Dr. Raj, are you there? And can you unmute yourself to give a quick update on Unilever, please?
Yeah, I can do that. Thank you very much. In fact, is it possible for me to share my screen, Barry?
Let me see here.
If you give me the rights, I can just quickly share what I have.
Can you see it?
Can I? Yeah, I can see it. Yeah.
Okay.
Okay. So let me see what I can do now to share my screen. Is this seen or not yet?
I can't.
Do you see any?
I can't see it right now.
You can see it now? Or 1 minute, I'll just see whether I can share my screen. Can you see it?
No, I can't.
Okay, so you can't. Okay, so I will now try again. I'm just saying share. So how do I share my screen? That's the only thing, because I'm not able to get through, and I can share my entire screen. Okay.
You should be receiving a request, but if it doesn't work, please just go ahead and share.
Okay. What I'll do is, Barry, in the meantime, I'm just sending you my presentation, and you should probably get into it in a couple of minutes. But I'll go ahead and share. I'll just go ahead and talk. At least you can hear me, right?
Yes, we can hear you.
Okay, fine. So what I want to do in the next few minutes is to talk to you about the Unilever strategy of return to workplace. And essentially, if I actually look at my strategy, we look at return to workplace from 4 lenses. One is from the lens of WHO, the gating criteria, the Unilever lens, the local government lens, and the employee lens. And if we look at the health indicators, everyone has spoken of what to do once you come back. But the point I'm going to talk about is, how do you get back? When do you decide to get back? So we have a set of internal indicators and external indicators which we use. In terms of internal indicators, we look at 3 stuff: employee cases, employee sickness, absenteeism, and employee isolation or quarantine, or staying away from work because of illness. Essentially, we classify the return to workplace into 4 criteria, into 4 tiers: 1, 2, 3, and 4. 1 being the most favorable, when everyone can come back to work. 4 being an issue because a lot of employees have symptoms, and it is all graded according to this. But if you look at the key external health criteria of return to work, we want everyone to return to work only in tier 3. And what do I mean by that? The WHO transmission of cases in tier 3 would be a cluster of cases. So we look at the WHO transmission status. We look at published RO, or the reproductive index of the virus. If it is available in between 0.7 to 1, it will be a cluster of cases. If it is more than 1, it will be tier 4, which is called as a community transmission. If it is less than 0.7, we call it as tier 2 or sporadic cases according to WHO. And if there are no cases, new cases, it is called as tier 1. Now we look at various other factors when getting back to work. One is, what is the national trajectory of new cases? If we observe that over the past 14 days, the cases are coming down. If we observe that over the past 14 days, the deaths are coming down. And then we also look at hospital capacity and see whether it is under strain or not. If the hospital capacity is totally under strain, then it would be a community transmission where that is tier 4, where people are not able to get into the hospital. However, if you find that the hospital capacity is under strain, with some cancellation of only the most urgent care, that would be a tier 3. And then we look at the same factors in tier 2 also, whether it is the trajectory of new cases or trajectory of deaths or the hospital capability or capacity. And finally, the new normal would be when, as compared to the pre-COVID era days, if you find that hospitals have absolutely sufficient capacity to treat all cases, not only the COVID-19, ICU beds are available in plenty if needed. And more importantly, when you look at testing, for number of cases of test for the COVID according to the PCR method, you find less and less positive cases. That's a sure enough sign that you can surely get back to work. So this is a combination of two factors: the internal health indicators, which I told you about, employee cases, absenteeism, and the other one of quarantine, and the external health indicators, which look at all the other factors like RO, published information, hospital capacity, and stuff like that. We also look at market indicators for coming out. And there are two key market indicators which we look at. One is public transportation, and the other is social gathering. If you find that the country has not opened up to public transportation, it would actually be in the higher tiers, so we would be very worried about getting back to work with all guns blazing. But what we do is, at a tier 3, provided other criteria which I spoke are met, if people are using their own private mode of transportation, or they are coming in through company shuttle buses and stuff like that, with social distancing, wearing of masks and all other parameters which we actually advocate, then we are happy to let people come back to work. The way we look at it, ladies and gentlemen, is that if a government declares a country as open for business, then we wait for at least 3 weeks after the declaration to allow our people to come back, provided the other criteria have been met. The reason for waiting for 3 weeks is that very often the countries swing from tier to tier. You could see a classical example in Germany where they had to open and get back to a situation of closeness again. So we don't want people to swing from tier to tier, and therefore we look at this sort of a thing. Wolf, just a quick question. Have you received my presentation?
I have not, but I think we may not be able to do this given the time frame. We still want to have.
Okay, fine. That's fine. So this was the way in which I just wanted to tell you that we have 5 tiers. Tier 1 is risk low, tier 2 is medium, tier 3 is high, risk is very high is tier 4. And we base it, like I said in summary, on the basis of RO, WHO status, medical, and other public health factors. But there are 6, just the last one.
I just have some more questions, but please carry on.
Sorry. Just to finalize, there are 6 safe principles which we look at. One is preparing the building, preparing the workforce, control of the access, creating a social distance plan. Incidentally, we use the 6 feet criteria. And then we also look at reducing touch points and cleaning and communication for confidence. So these are the various ways in which we actually look at getting back to work.
Okay, thank you. Thank you very much. And we'd be very happy to receive your presentation, and we can send it out after this.
Absolutely. I have in fact sent it to Wolf. He should receive it. Yeah.
Lovely. That would be great. I just want to take some questions, and I think if Andreas is still on the line, Andreas Irm, I hope I pronounced that correctly. Andreas, do you want to unmute yourself and ask a question? And I think your question might be especially for Dietmar, but Andreas, are you there? I think Andreas may have just dropped off, but I do have he's posted his question. Dietmar, in recommending with employees returning to work over the summer season, do you recommend PCR tests or other measures?
We have no official recommendation on this. We offer these tests, if employees want to use them, but I think there's also an issue of data protection and potential discrimination and so on. So there's a lot of discussion on this. So I think there should not be an obligation for this testing. So if it's as a facultative measure, yes, but there should not be an obligation.
Louis, is that a view you concur with?
Yes, thank you. Actually, I think Dietmar correctly pointed out there are some issues around data privacy that we are look at in some regulations. In some other countries, there's no restriction, and employers are free to request such a test. But the recommendation is, even if you have the tests available, that should not mean that you lower your attentiveness, right? Because as the WHO pointed out, that there's still some things that are unknown about the virus. So it's not for sure that we have created a degree of immunity that would allow us to just go out back to normal.
Thank you very much. So I'm opening it up to anyone really. I know Alberto has a question, but Edith, are you there from Ghana? Some people, you may have dropped out, but if you are there, no.
Yes.
Yes, great. I got all the names, but thank you very much. Edith, please say.
Okay. So the situation in Ghana is one where, can you hear me, please?
We can.
Can you hear me? Are you hearing me?
Yes, we can. Yes, we can. Please carry on.
Okay. Yeah, so we have a situation in Ghana where there was a partial lockdown of 2 major cities when cases started coming in. And at the moment, we are at 7,000 plus people who have tested positive with 34 deaths. That's about a 0.5% of the cases resulting in deaths. And this is because the enhanced surveillance method of contact tracing has been intensively pursued. The contact of people with who tested positive are followed up, and they have also been tested isolated. And we find that the benefits of that, people tended to be picked up rather early. So we've not had too many cases falling ill very severely. Now, as a result of that, the lockdown measures have been relaxed and people are now going back to work. The government has in place issued a protocol, just like in other countries, emphasizing social distancing and hand hygiene. And the workplaces have added on screening for temperature as people go to work. And that's about all that is standard. Most other things are, at the behest of companies. Now, there are some few challenges, that are becoming evident. Challenges such as stigma for people who have tested positive, to the extent that in some cases, within their own community, they are not accepted. They go to buy food and people are reluctant to sell to them. And this stigmatization even extends to their families. So the real problem now is for such people going back to work, and not feeling accepted by their peers because they've had the disease. Hence, we see the need now for more information provision, because a lot of this is due to misinformation as well. And then secondly, psychological counseling for those people who have been affected. Psychological counseling is one area that has not been emphasized much in the workplace. So this is a new need that is really emerging. Another challenge we see is that of protocol compliance fatigue, as we call it. People went in back to work quite enthusiastic about applying the rules, of social distancing, hand hygiene. Now you go to some of the workplaces and you find that the insistence on people washing their hands before they enter the workplace or taking temperatures may not necessarily be enforced. So we see that over time, some amount of fatigue is already setting in, and the question is how long will people be able to sustain these efforts. Another issue we're having is some people, a lot of people are now trying teleworking, which, as we all know, offers new opportunities. But not all the workplaces are set up to take advantage of this. So for many industries, for whom teleworking is not, it is a very new thing, they are naive to it. They are really struggling to get back on their feet. Now, last but not the least is the issue of the informal sector, which in most of Africa and in Ghana, for example, constitutes over 70% of persons. You have, for example, in the markets, a lot of crowding, so that social distancing doesn't seem to be working at all. The use of masks, for example, is not working. People are just, continuing their normal activities as if there was nothing happening. Plus, there are some among them who are even in denial, because they have not seen so many deaths,
Edith,
as a result of
Edith, I'm going to stop you. Edith, I'm going to stop you. Thank you. But you actually made a lot of really good points, and I just want to bring in one more. But you talked about stigma and psychological counseling and sustaining good practices and informal sectors. It's a bit of feedback on your communication, but you raised some very, very interesting points that haven't come up often in these debates. So I want to thank you very much for that. We have very short a time, so I just want to take in one more. Would anyone like to come in and ask either a question or make a short comment?
Harry, I have a short comment on the RT-PCR test as a tool for return to work. So in Unilever, we don't actually insist on a PCR test for return to work. There's a very simple reason for that. A negative or a positive test at one point of time does not preclude anything in the future. So that's not really a very true test. It's only a snapshot, number one. Number two, what also happens is that we must understand that almost 20% of the RT-PCR can turn out to be false positive or false negative. It's the positives are positive, but you can miss it out also, because there's a 20% chances of missing it out. So we don't do that. What we otherwise standardly do is that if you have just recovered from an infection, we say that you should have a 10-day period free of symptoms and at least 72 hours without any fever, without the use of fever reducing medication. That's our standard approach. Allow them to come back. A lot of talk on antibody tests. We don't advocate it for the same reason. Reliability, sensitivity, specificity is an issue. And how long the immunity lasts, nobody knows. So we don't advocate either of these as a tool for return to work. Just thought I would share with you.
That's really helpful. Thank you very much indeed. One other quick question or comment. Open house. Just unmic yourself if you wish to ask. Alberto, would you like to say something? So maybe one other final question for myself, if just for an open house to answer it. In terms of travelers, workers traveling from one country to another, some countries, including the UK, is thinking about imposing a quarantine period. Is there any thoughts on how that could be dealt with? And whilst perhaps Lewis, maybe while you're thinking about that, Andre has asked the question, how do you see technology efforts like apps and software helping companies during this period? Just one minute to answer both those questions. Thank you.
Thank you. Well, indeed, the two questions are quite linked, because one thing that we found from this pandemic, one lesson learned, is all the advantages that we can have by the use of these apps. So traveling, well, we are always advising to keep it at the minimum necessary. Indeed, there's still a lot of restrictions for traveling, and with the teleconferencing such as the one we are holding now, we have found that we are capable of being productive. So at the extent that we can keep on running our businesses by the use of these technologies, we strongly advise that. This is a lesson. This is something we should embrace. and we should promote also skilling and reskilling on the use of technologies to take the most of it. Again, traveling well to the minimum necessary for the moment, and this is aligned also with the recommendations from coming from the WHO as well.
Thank you very much indeed. I'd like to thank all of our contributors, very kind for giving up your time. The rest of you all for participating and making this, I think, a very successful discussion. Thank you, Stephen, who's posted a question just now, and I hope perhaps we can take that one afterwards. Just to remind you that there is a COVID-19 resource on our website. Award applications are open, and a big thank you to all our presenters, to Wolf, to Barry, and to everyone else. Thank you very much. And we do have another one coming up on the Asia Pacific region next week, and we'll keep informed about future webinars. Thank you very much indeed.
Thanks, Tommy. Thanks, everybody.
Thanks, everybody.
See you soon.
Thanks.
Bye-bye.
Bye-bye.
Thank you. It was a nice meeting. Thank you.
Thanks.